Yes. Yes, yes.
Okay, so we will start. بسم الله الرحمن الرحيم. أول حاجة كل عام وانتم طيبين إن شاء الله، شهر مبارك علينا وعليكم. So today we will have physiological response to exercise, cardiorespiratory focus. So we have our objectives for this lecture is to demonstrate a basic knowledge of energy source during exercise, the steady state, our second wind, oxygen depth, respiratory response to exercise, cardiovascular response to exercise, effects of athletic training on muscles and muscle performance, and body fitness with prolonging our lives. أول حاجة اللي هو muscular exercise. So we are talking about a type of exercise is a muscular exercise. So there are different types of exercise. So focusing on physiological part, muscular exercise, we need to know اللي هو more things about the effect of muscles during exercise on the cardiorespiratory system. So of course there are few stresses the body is exposed to that lead اللي هو to stress on the body. One of them is the stresses of heavy exercise. So we are mainly focused on the heavy exercise, like marathon or athletes, individuals who are doing their marathon or are so fit for their body. So many cardiovascular and respiratory mechanisms must be operate in integrated fashion for oxygen to be اللي هو giving to active tissue. This is important اللي هو to meet the extra اللي هو demand for اللي هو the body and removing of carbon dioxide and heat. Muscle contraction is of course require more energy and producing a lot of heat and carbon dioxide to produce اللي هو energy. طبعا this is need oxygen and nutrients, especially glucose. So muscle act as a machine, converting chemical molecules into work. So of course they act as a machine because it has a mitochondrial. So mitochondria is important in اللي هو muscle production of energy. So if we go in energy sources during exercise, we have اللي هو important اللي هو energy sources ATP and creatine phosphate. So any organs that rich in organic phosphate like ATP and creatine phosphate يعتبر من immediate source of energy for the muscle contraction. In normal sedentary individuals, that individuals not active. Sedentaries mean in inactive individuals. About 20% of low liberated energy is converted into work. While in well-trained athletes, they utilize around 30 to 40% of their liberated energy for producing the work. Okay. What is the difference between anaerobic and aerobic metabolism? Of course, this is in biochemistry. You may know what is anaerobic and aerobic metabolism. So anaerobic metabolism, when there is inadequate of oxygen, but I need to metabolize it energy to produce اللي هو metabolize the molecules to produce energy. So when oxygen is inadequate, a little amount of energy will be there. Is opposite to when there is an aerobic metabolism where there is enough of oxygen, a lot of اللي هو energy will be produced. The anaerobic metabolism can be useful in the beginning of the severe exercise, but it also need to be in a short duration. As you know, this is a little low energy. For example, carbon dioxide, carbohydrates important molecules can be supply the energy during anaerobic metabolism. While in aerobic metabolism, the best one is fat or lipids. So oxidation of the lipids will produce a greater energy, can be used for longer duration, and as in marathon. What is a steady state or second wind? So it is very common in athletes when they are performing their prolonged muscular exercise. Okay, this is steady state or second wind. In the beginning of the exercise, they start to suffer dyspnea, shortness of breath, but this will be disappear after some times. In the beginning of this dyspnea, it is due to oxygen insufficiency, okay, because you already have oxygen used or stored in the body, but when the muscle is become active, you need more oxygen. So oxygen in the beginning become insufficient in the beginning of the exercise, and then anaerobic glycolysis will utilize cause accumulation, burning down of glucose and accumulation of lactic acids, which is required to be neutralized by alkali, a strong alkali, which is sodium bicarbonate. So this will lead to liberation of carbon dioxide and sodium lactate and water. But carbon dioxide the main stimulus for respiratory center to stimulate respiratory center to what? To increase breathing. So that will lead to removal of the carbon dioxide produced by this muscle during this severe exercise or strenuous exercise. This will lead to dyspnea. Well, after a period of time, well, still we are in a stable, right? We're still not steady yet. But after a period of time, depends on physical fitness of athletes. What does that mean, fitness of athletes? Their muscle of respiration, okay? Their reservoir of oxygen, their ability to maintain adaptation to exercise. So depend on the physical fitness of athletes and the severity of exercise. Of course, there is a degree of exercise. So the severity of exercise, respiratory and circulatory rates will be increased. And energy will be derived from aerobic, shift to the aerobic metabolism, will that lead to no lactic acid production. So the dyspnea then will disappear. Okay, the equation now is shifted from anaerobic to aerobic, and the dyspnea will disappear, will exercise maintain more comfortable, and now athletes are in a steady state. Steady state can be reached more rapidly by training. The more you are trained, the more you're gonna have reaching steady state. So this is normal, guys, if you got dyspnea when you have exercise. This is something normal as long as you don't have cardiorespiratory diseases. So how fast you're gonna reach the steady state, it depends how much you are fit. The more you train, is the better you will reach steady state. There is another terminology is called oxygen depth. Oxygen depth or excess post-exercise oxygen consumption. What does that mean? I'm gonna use oxygen after exercise. And that is an excess one. It's not a little one. I'm gonna use an excess of oxygen after exercise. So it is an extra oxygen consumed above a resting level during recovery after exercise. After exercise, it's called a recovery state. بيحصل فيها replenish the energy stores, ATP that I used it in the exercise or creatine phosphate. I need to build it again, and I need to use or consume lactic acid that I build it in the tissue. So the body contains about 2 liters of stored oxygen, around 2 liters of oxygen in our body as stored that can be used for aerobic metabolism when we shift from anaerobic to aerobic, even without breathing any new oxygen. So you have your own building up of your oxygen ready for the beginning or start of the exercise. But in heavy exercise, you need more than that. So all this oxygen will be used within a minute. So what happened? You need to after exercise over to restore your oxygen level. So replenish it by breathing extra amount of oxygen over the normal requirements. Yeah, at your level, your resting time, your resting condition, you stop exercise, it's called recovery, and then you will breathe extra amount of oxygen above or over than normal level of ventilation. So in addition, around 9 liters more oxygen consumed to produce energy that replenish ATP and creatine phosphate and for oxidation of lactic acids. So you need to use it not for the storage also, but you need also to synthesize your energy for the next workout to be ready. This is was showing how oxygen depth appear after recovery after recovery state. This is an y-axis where there is oxygen consumption, and then on x-axis there is time of exercise. So in the beginning of the exercise, at the start, what happened is that oxygen consumption will increase. In the beginning will become so fast, and then gradually increase, and then after that you will reach a steady state where you use oxygen consumption. Okay, you are comfortable, you are not in dyspnea, and oxygen consumption is stable. And then after that, after you've done your exercise, what happened is that you stop it directly, and then or abruptly, and then what happened is your oxygen consumption is not is changed. طبعا gonna be changed. What happened is gonna decrease gradually, and that gradual decrease of oxygen of oxygen consumption because of oxygen depth. Okay, so you will continue have a breathing. Okay, hyperventilation until the end of recovery, and when the body knows that okay, there is enough oxygen in the body, there is more enough energy is built up. So this is very important. So the area here on the purple color, which is above the curve, is showing the oxygen deficit. Your body doesn't have it. You can have a dyspnea until you reach a steady state, and then after that, the area here and this curve, the blue color, is showing the oxygen depth, extra oxygen that you need to have it to consume it to reach recovery state. Okay. Though lactic acid is the main cause of fatigue, okay, but it exerts important functions. Actually, lactic acids produce vasodilatation to the muscle, skeletal muscle, blood vessel, and increasing their blood flow. So يعتبر من local regulator للblood flow to the skeletal muscle. But this metabolism is important. We need vasodilatation during exercise for the muscle. It shifts the oxygen dissociation curve to the right. So this is if you remember oxygen dissociation curve to the right when we need more oxygen, so we give oxygen to the tissue, and it is oxidized also in recovery period. لازم يحصل oxidation. Okay, 20% of lactic acid will help in replenish the energy source عشان produce ATP or synthesize ATP and creatine phosphate. It diffuses into the blood. طبعا of course it's come from the tissue to the blood, where it is used as a fuel by cardiac muscle. It also converted into glycogen in liver. Okay, يعني يعتبر another storage of energy. in the form of glycogen, around 80%. And then it stimulates the cardiac and the respiratory center, of course, because it's producing what? اللي هو, if you remember, lactic acid can produce carbon dioxide during neutralization, and carbon dioxide is a stronger اللي هو stimulus for اللي هو central respiration, طبعا which increase طبعا oxygen supply, and that why you feel you are hyper ventilated. Respiratory response to exercise. What happened to your respiratory اللي هو system? طبعا untrained persons can increase their basal oxygen consumption from اللي هو around 250 milli per minute up to 8-10 times. Okay. Well-trained athletes can attain around 14 to 16 time increase. Super athletes can increase up to 20 times. That means your dyspnea will improve if you are well-trained. So in the beginning, it's okay to have dyspnea, but the severity will be decreased while you are trained. Your muscle becomes stronger, your respiratory muscle stronger. You are able to breathe very breathe in the right way. So you use your abdomen to help diaphragm to going down and increase your decrease the pressure in your lung. This will increase lung volume, so will help have more oxygen. And instead you have a shallow breathing, you're gonna have very long deep breathing. So this will improve your respiratory response to exercise. Stimulation of maximum oxygen consumption is considered the best index of a state of physical fitness. This is very important. There's maximum oxygen consumption. We need to know what is the maximum oxygen consumption. So maximum oxygen consumption is highest level of oxygen your body can consume it. Okay, and this is mean your body is active. If you don't use the maximum oxygen, that means your body is inactive and the receptors is become lower and your body not adapted to exercise. So the highest is the better, and also come with training. Let's some respiratory response to exercise. It increases the pulmonary ventilation, of course, due to impulses from the motor cerebral cortex and the respiratory center to your this to the respiratory muscles through mechanoreceptors, and respiratory chemoreceptors due to the carbon dioxide and oxygen. Thermal receptors, طبعا thermal receptors, because the heat that you produce, the energy, you're gonna have a lot of heat. Thermal receptors will also increase the pulmonary ventilation. Cardiovascular mechanoreceptors all blood vessels in the chest has all these mechanoreceptors. Will feel changes in the pressure, will changes in the volume, so will has role in increasing pulmonary ventilation. All of these will stimulated in the by the respiratory centers or central nervous system. طبعا the respiratory volume may reach 200 liters per minute due to increased respiratory frequency up to 60 to 70 breaths per minute, and increase the tidal volume up to 3 to 4 liters. All right. Also increase the oxygen diffusing capacity, and this is important. Why? Because dilatation of the already open pulmonary capillaries. Now, not all your capillaries at rest will be open. Pulmonary capillaries can be not there. There is capillary, but the blood is not there, shifted. It's calling dead spaces. This where the alveoli become collapse, the capillaries is not filled with the blood. So is يعني يعتبر من الefficient اللي هو أنا preserve this energy. ليش أفتحها وهي not used. So by exercise increase the oxygen diffusing capacity, and that's why you will improve your dyspnea with time. So opening of the closed pulmonary capillaries, more expansion of the alveoli. So increase the oxygen also download to the muscles. More oxygen اللي هو will be given, maximum oxygen consumption will be increased. So oxygen entering the blood may increase from 250 milli per minute at rest up to 4,000 milli per minute during exercise. Oxygen removal may increase from carbon dioxide removal can increase from 200 up to 8,000 milli per minute. So increased oxygen download to the muscles, shifting curve to the right. Okay. Stimulation of respiration during exercise again. During exercise also respiration is stimulated mainly by neurogenic mechanism during exercise. So part of this mechanism, stimulation results from direct stimulation of respiratory center by the same nervous signals, of course. This is a hierarchy for control. في عندنا الميدالري وفي عندنا البونتاين وفي عندنا different اللي هو groups of controller in the for respiratory ventilation. These are signals that are transmitted from the brain to the muscle to cause اللي هو exercise. We have also additional part is result from sensory signal اللي هو transmitted into the respiratory center from the contracting muscles and moving joints, and this is اللي هو also important because sensory signals it help also to اللي هو sending اللي هو output from the brain to the muscle to contract. All right. So not only for the respiratory system, not only the nervous system control the respiration, also اللي هو control اللي هو respiration, extra can control respiration also by skeletal muscle. Anyway, we're gonna have the blood gases during exercise. So we talk about how اللي هو skeletal muscles, muscles of respiration. And now we're going to talk about the blood gases during exercise, how they can play a role in heavy exercise. So the oxygen pressure of the arterial blood and carbon dioxide pressure of the venous blood remain nearly normal. So yes, this is important. We know that there is something called homeostasis of these levels at rest or during exercise. This should be not changed. This is indicate what? Indicate that there is extreme ability of the respiratory system to provide an adequate aeration for the blood even during heavy exercise. There is important point here to maintain homeostasis. All right. What about the maximum oxygen uptake, VO2 max? It is the rate of oxygen consumption. We talk about the maximum oxygen consumption, but I want to talk about the rate. How fast is it? Under a maximum aerobic metabolism should be. And it can be calculated by the fixed equation. VO2 max is equal to cardiac output multiplied by the arterial oxygen minus venous oxygen. VO2 max, it's around 38 milliliter per kg per minute in active healthy men, and lower, of course, in healthy women, 29 milliliter per kg per minute. VO2 max is the product of maximal cardiac output and oxygen and maximum oxygen extraction by the tissue. How fast the tissue extracts oxygen, and what is how much maximum cardiac output is, and both increase طبعا مع training cardiac output is improved or increased, or maximum oxygen extraction will be increased, and that's mean maximum oxygen uptake. If you want to improve it, it will be need to do more training. So what is the importance and the significance of VO2 max? VO2 max reach when طبعا the increased oxygen consumption reaches a steady state despite increased exercise. This is good. What does that mean? While you are doing exercise, as you see here in this curve, we have oxygen consumption on the y-axis and exercise intensity on the x-axis. So oxygen consumption, of course, will be increased. Oxygen consumption increased while you are doing exercise. Exercise intensity is increased, but at some time, VO2 max will reach a steady state. And this is اللي هو indicate اللي هو fit or healthy اللي هو fit individuals. So what are the factors affecting the VO2 max? There are some factors can affect the VO2 max. We need to improve our VO2 max, to increase it. We need to take care of it. So by cardiac output, so increasing the cardiac output by exercise, pulmonary diffusion capacity by exercise, excuse me, and the oxygen carrying capacity, again by exercise, muscle diffusion capacity, mitochondrial enzymes, capillary density. All these factors are increased by exercise. There is no way to increase VO2 without exercise. The erythropoietin can boost VO2 max by increasing mean can increase. There are some researches showing that erythropoietin, the hormone that producing red blood cells, can boost the VO2 max by a significant amount, and this makes it attractive. Some athletes using it to improve their endurance activity. So let's go to the effects on cardiovascular. Cardiovascular response to exercise. So once we're done after finishing the respiratory, let's go to the cardiovascular. During exercise, the heart rate may increase by sympathetic system from 70 beats per minute to about 180 beats per minute. That's a big number. During exercise, the stroke volume may increase from about 70 milli per beat to about 120 milli per beat. Again, that's a huge one. Cardiac output, which is equal to the heart rate multiplied by the stroke volume. If we think about exercise, cardiac output may increase from about 5 liters to 25 liters per minute. We know that training and athletes, individuals have a lower heart rate. If you remember the case with the lower heart rate, you have it in CRF. The patients, the case can talk about lower heart rate and the response due to response of exercise. Without decrease طبعا في الcarbon monoxide, because concomitant increase in stroke volume. While the stroke volume is increased, هيكون even the heart rate is lower, cardiac output will be increased. So taking care of the stroke volume, because the cardiac output will improve. This is when the heart is reached the efficient beat or pump. And this is by training, of course, as in athletes. The causes, just I want to add here something here. Okay, we said that during exercise heart rate may increase. So the increase is by the sympathetic system. And those individuals who have a low heart rate is increased, this is still not adapted to exercise. So heart rate increase in the beginner, okay, في الactivity تبع exercise. Like with time, because they are well trained, the heart rate is turned to down, okay, is decreased. Once it's decreased, that means your heart is efficient. Now few beats require just to push large volume of blood. That is so efficient. No, less energy, more efficient work. Okay. The causes of increase of the stroke volume cardiac output. As we say, sympathetic stimulation leads to increase in myocardial contraction. Increase طبعا venous return lead to the dilatation of the ventricles. increase the force of contraction by starting low, if you remember it. Physiological left ventricular hypertrophy, this is happening. And that's why their stroke volume is increased, because they go into left ventricular hypertrophy. Their muscle is very strong. And that is physiological one. Okay. The causes of increased venous return in the heart. respiratory طبعا movements of course لما احنا نعمل deep inspiration بيحصل ايش decrease اللي هو pressure, increase اللي هو blood back to the heart, to the right side of the heart, so increase اللي هو heart contraction. Cardiac طبعا suctioning اللي هو because of deep inspiration. Muscle activity, muscle activity and venous اللي هو valves اللي occur in this at the level of the skeletal muscle. Skeletal muscle acts as a pump. It push the blood toward اللي هو the heart. Okay. الفينوموتور تون طبعا الكونتينوس اللي هو sympathetic activity على vasoconstriction. Okay. Back اللي هو بيعمل ايش to the heart. The pressure gradients. The pressure gradient اللي هو the difference between the mean circulatory pressure and the right اللي هو atrial pressure. This اللي هو also increase the venous return, because you have the bigger pressure طبعا اللي هو the higher back of the venous blood venous return. What about the blood pressure during exercise? Here are some tricky things you need to know. The blood pressure during exercise, أولاً the blood pressure is equal to the cardiac output multiplied by the peripheral resistance. During exercise, systolic blood pressure increase 30 to 40% because of increase in stroke volume and cardiac output, because you have bigger contraction. Strong contraction of the ventricle will push the blood strongly to against the aorta. So this will increase the systolic blood pressure. There is either no change or decrease in diastolic pressure. Some individuals who have this exercise, they suffer from decrease in the diastolic pressure, and the decrease in the diastolic pressure can affect in not a good way, but usually majority of those individuals, they will have no change or a little decrease in the diastolic pressure, and this is يعتبر ايش من requires for maintaining normal blood pressure or avoiding hypertension with your age, with aging. But this is because of decreased peripheral resistance. As we said, there is a lot of metabolites during exercise go to the circulation. It acts as a local regulator to blood flow. So that's why it causes decrease in peripheral resistance. We need blood flow to the heart, to the brain, to the skeletal muscles. So we need to have vasodilatation. So that's will decrease diastolic or maintain, not change. Endurance طبعا training في حالة endurance training they tend to decrease resting and exercise systolic pressure. مع time لما يكون endurance training with time, again same to the heart rate what happening in the beginning, لكن with training endurance individuals will have a lower level of systolic pressure with time, and this is also safer with time for them. ليه؟ لأنه the blood tend to the adaptation of the vasculature to the blood flow will increase with the time of training. What about the blood flow during exercise? As we said, there is a redistribution of the blood flow from the inactive to active tissues. The blood flow maintained to the heart, to the brain, to the skeletal muscle. Brain and heart are spared from vasoconstriction. Anyway, it is sympathetic fight and flight, but no vasoconstriction to these organs. Occur in other areas, yes, can occur in other areas, but not in these organs. The blood flow to the cardiac muscle increases due to coronary vasodilation. Excuse me. So what are the causes of high blood flow to the cardiac muscle? Coronary vasodilatation. Why? Because increase الcontractility, increase الكربون dioxide, increase اللي هو كل الميتابولايتس النيتريك اوكسايدز وكل الميتابولايتس اللي بتحصل اللي هو بتعمل الانكريز وتعمل ايش؟ vasodilatation. Okay. High density of cardiac capillaries. Again. A high density اللي هو of the capillarities in the heart it's occur as in skeletal muscles, and this is increased growth, new growth of capillaries in heart is due to high activities of the heart because of the training. So we'll have a difference. Of course, there is a difference in the capillarities between the trained or untrained, سواء في heart or skeletal muscle. That is occurred to compensate the increase in oxygen demand during a heavy exercise. That's due to heavy exercise, not in sedentary individuals. Coronary blood flow increased from 260 milli per minute to 900 milli per minute. So this is also a huge number. Skeletal muscle blood flow increases 30-fold due to increase in both the nervous, the sympathetic vasodilators, and humoral accumulation of vasodilator metabolites such as carbon dioxide, hydrogen, and potassium. As we said, local وكذلك lactic acids. This is local regulation. Blood flow to spleen, kidneys طبعا decrease because we don't need this blood flow to these organs. Blood flow to visceral also decrease because the effect of the sympathetic vasoconstriction. Cutaneous blood flow initially decrease, sympathetic طبعا effects, but it later بيكون فيها increase علشان الهيتس اللي بتحصل في اللي هو during الexercise يحصل heat اللي هو dissociation لازم يطلع الهيت من الجسم فيحصل vasodilatation. There is a linear increase in arteriovenous oxygen difference with the intensity of exercise from 5 milli oxygen percent to 15 milli oxygen percent. So this is the difference between اللي هو arteriovenous oxygen. Why? Because you have huge amount of oxygen going to the tissue. Going to have huge amount of oxygen removed or not there by the venous, so going to have a big difference. Okay. The effect of athletic training on the muscle and muscle performance. The changes that occur inside hypertrophied muscle fibers include طبعا الناس اللي بيكونوا اللي هو under trained their muscle become اللي هو hypertrophied. ليش؟ Because they want to اللي هو produce more اللي هو activity. So mitochondrial number increase, muscle size is increased. So these changes occur in hypertrophied muscle. أول حاجة بيكون عندنا the numbers of myofibrils is increased proportionate to the degree of hypertrophy. The higher hypertrophy, the higher myofibrils. Okay, this makes sense because this is part of the muscle tissue building. Increase in mitochondrial enzymes. Since there is increase in mitochondria, of course there are going to be increase in mitochondrial enzymes. Increase in components of the So increase the components of اللي هو phosphogenic metabolic system including ATP and phosphocreatine energy product لأنها بتخزن هذه الأشياء because they gonna need it all the time. So the muscle is hypertrophied, bigger. It has a lot of storage of اللي هو glycogen, a lot of storage of triglyceride, ATP, phosphocreatine are ready all the time. Because of all these changes, the capabilities of the anaerobic and aerobic metabolic system are increased, increasing the maximum oxidation rate and efficiency of the oxidative metabolic system is efficient with lower energy and higher. Lower energy you need to produce high amount of energy. So if you want to burn if you want to produce a powerful of training, the body can oxidate a lot of fats and produce more energy with lower energy utilized, because the muscle now has a large number of factories, large number of storage. They know they just need a little bit of energy to produce. A lot of blood is there, a lot of capillaries is there, a lot of ATP is there, a lot. Okay, so you're gonna have a reaching one efficiency of oxidation of this system. Beneficial effects of the training. What are the beneficial effects of the training? Again, kind of summary, guys. VO2 max is the product of maximum cardiac output and maximum oxygen extraction by tissues, and both increase with training. Trained athletes have a larger stroke volume, lower heart rate than untrained. Okay, agree? The heart pumping effectiveness of each heartbeat is 40 to 50% greater in the highly trained athlete than untrained person or sedentary individuals. Training tends to decrease resting and exercises to the pressure. That is a high level of fitness. Training increasing blood supply to the skeletal muscle and increasing the current blood flow, of course. Not because of the metabolism only, but also by building the new capillaries in these muscles. The important thing is exercise is important for your life. Well, longevity associated with exercise. So body fitness prolongs life. The two evident reasons are, number one, first, body fitness and weight control greatly reduce cardiovascular disease. And you're going to losing your body weight because of activity of using all these energies. That no fat deposition anymore, oxidation and production. Oxidation very active. This results from a maintenance of moderately lower blood pressure. Of course, you can have an effective, positively at blood pressure. Reduce the blood cholesterol and low density lipoprotein, along with increase the high density lipoprotein because of the effects of, as we said, metabolism. These changes reduce the number of heart attacks and brain strokes. And all these factors, as we said, help in maintaining good and healthy cardiovascular system. Second, the athletically fit person has more bodily reserves to call on when he or she does become sick. What does that mean? Exercise can mean like prehab for your body when you have a disease. If you want to maintain your body or if you want to get out from sickness while you are very strong and have no complications, okay, then that's mean your body is have a lot of beneficial things reserved to wake you up from this disease. Why is that? Is because, as we said, there is a lot of blood capillary. So if there is a stroke, for example, or myocardial infarction for one capillary, for one artery, there are another mesh of capillaries of blood vessels will work and try to pass through this strangulation that your body have. Also, you have a low reserve of oxygen level. Your lung, for example, has a lot of blood capillary open, alveoli is open. So if there is any damage for one organ, there are a lot of reserve there. They can help in to fix the problem faster. You can have recovery, faster recovery, and lower اللي هو complication. And that's what we need, guys. We need to make our body strong to face all these things that happen with your life. And that's it, I think, for this lecture. These are our resources. You guys, if you have any question, you can ask. You can ask anytime, here, there, anywhere, but also you can feel free to leave if you don't have any question. You guys, do you hear me? Do you listen?
Yes.
Yes. Okay, that's good. Just I want to make sure.
Thank you, doctor.
You're welcome, guys. Good luck for you all. Let me see, where are you guys? I can't see anything here. I'm probably here. Okay. Why you have only lower number? I'll just get out in here.